get going. So let's say morning to everyone, and thank you much for joining us this morning. So I'm Olivia, one of the co-presidents of the Society of Scottish Artists, and this is the final SSA Council Forum out of the events. So this forum will be about up to an hour, so there'll be about 45 minutes of conversation with 15 minutes at the end to ask any questions. We also want to encourage questions throughout the event as well, because it is a conversation. So if you do have any questions, just the chat box at the bottom. If you just want to pop them in there, and then I'll interrupt Sinead and Gillian when they're talking, and so we can ask the questions throughout to keep the conversation flowing. So we're joined today by Gillian McFarland, who's one of our council members. She's also an artist and an SSA professional member. So within her practice, she's really interested in collaborating, working across disciplines, and particularly influenced by both science and the natural world. And then we're also joined by Sinead Braiden, who's a state registered art psychotherapist with 14 years of experience working in the NHS and the voluntary sector. So she's really interested in how looking at different forms of creativity to allow people to tell their story and express their emotions. So I guess I'll hand it over to you guys for the conversation. Really looking forward to it.
Thank
you.
Over to you. Thank you very much. Right, I'm just going to attempt to screen share now, if I can get this on here. And get that on, up and on to, right. Does that come through? Okay.
Yeah,
right.
Just need to put it onto full screen at the bottom. So
full screen, I think it is it? It says on mine.
Oh yeah, perfect, it is now, yeah.
Yes, okay, thank you. So, just really wanted to say, first of all, hello and welcome to what we hope will be an informal discussion, or a conversation, really an informal conversation between Sinead and myself. And we really want this to be informal, with comments from those joining us today. So please do, as Olivia said, use the chat box, and she'll pull in any questions, and we'll try and answer them as we go forward. We're hoping too that your questions might direct the flow of this conversation and take us into areas of interest for creative practitioners in particular. We're working in what really is quite a psychodynamic model that would be art therapy, with what presents itself within the room, so to speak. So what you bring into this room, we'd like to also work with. So we've called this conversation Following Threads, because that's something artists and therapists, I think Sinead would agree with me, have in common, that we might argue that, you know, this is how we're going to present this talk. The images in here that I've included are not illustrative, but are really images to remind us, I think, that artists and art therapists find imagery mesmerizing. Our eyes will focus on imagery, looking for the nuances, the subtleties, the relationships and inherent narratives. We can't really help ourselves in that. And so the images in this presentation are really there for that, to give us a visual provocation, so to speak, and to get our thoughts strolling and then rearranging and forming into clearer ideas. Throughout the preparation for this conversation, we have been intrigued, Sinead and I think, between how hard it is sometimes to own one's own personal identity, or one's own, professional identity, to feel validated when you name a role. You know, what does it mean to be the artist in your community? What does it mean to be the art therapist in an institution? Often you're seen to be on the periphery as an outsider, or to be different, someone of interest, the creative one. And I wonder if that's where art might place us. People we meet often seem fascinated by what an artist does. If you ever sit next to somebody in the bus and they ask you, what do? You know, you always kind of pause before you say you're an artist, or the same goes with an art therapist. And so in this conversation, we thought this might be a good place to kick off, telling you a little bit about how we work, who we are, and our creative practice. So Sinead, I'll maybe let you start on that one.
Okay, thank you very much, Gillian. My name's Sinead. As Olivia said in the intro, I've been working as an art therapist for about 14 years, which I can't quite believe when I say that out loud. When I was at school, I loved art, and I had this kind of vague, naive notion that I wanted a job where I could help people that possibly combined art as well. So I first heard of the job of art therapist when I was about 17, and I didn't really know what that was. Anyway, long story short, I went off to uni to study psychology. Kind of naively thought that once you had a psychology degree, that was you. You were a psychologist. Yeah, so, and there was loads of statistics and things in it, which still boggles my brain to this day. So I quit halfway through the psychology degree and went off to art school in Dundee. Loved it, had a great 4 years. And then about a year after, I finished at Duncan Jordanson. I went and did the art therapy training, which felt like quite a natural progression with my background. And that's kind of been me ever since. I've worked in adult psychiatry for the past 14 years in the NHS. That was my first job when Gillian went off on maternity leave. And I also worked with children and young people in residential and foster care. I did that for about 9 years. And so I was working full time, and now I work part time in adult psychiatry. So that's a bit about me.
Yeah. So I mean, I think maybe it's just to also put into here that I also trained, I maybe haven't made that so clear, that I also trained as an art therapist initially. I worked in adult and child and family psychiatry for about 15 years too. And I worked with Sinead, and then due to a family move, we moved south, and I decided then to go back to my own practice during the process of relocation, and took on a studio. And so that brought me from having worked in the way, in an institutional framework, to suddenly being having the freedom of being a practitioner, so an artist. I still struggle to say artist, actually. It's quite interesting that. And so I think one of the things that when we've been having these conversations is the differences between creative practice, if you're an artist, and most art therapists have undergone an art degree first, and how that differs from art that may be inherently therapeutic. And I think given COVID and everything that's been happening recently, there's this sense that we've all been looking into our art into our practice in a different way, and seeing how it has sustained us through what have been and are continuing to be difficult times. I put this slide up actually on this one. These are two very dear friends on this, who are co-founders of a women's collective that I'm part of. And I think for me, art practice, whether it's art therapy or my own personal practice, it is about this sharing, this almost being attuned in the moment. And I love this image of just watching somebody else working. So if you're in a studio, shared studio space, you know, that can be so sustaining, just having somebody else in that presence working alongside you, or, you know, you don't need to speak. It's a kind of an awareness and acceptance of what you want to say. And I think that very much, for me, Sinead, mirrored how art therapy worked. Mm-hmm. I don't know what you think on that.
I suppose it's slightly different to working in a studio setting, but yeah, very much about the person and how they come into the room. And kids will take to art materials so readily, as you know, but it's a bit harder in psychiatry. People are, you know, they're grown-ups, and they've kind of some of them have got a fear of art and of sitting with someone else and creating in that space. They don't have that same kind of, they're not drawn to the materials in the same way. There's kind of a fear there that, you know, when you become an adult.
I think there's always that element of risk, and I think that's the bit I often find quite fascinating, that, you know, when you work as an arts therapist, you can see fear when people come in the situation and they approach the art materials, and you're offering them something that's really scary. And yet children don't hesitate. They're fearless usually.
Yeah.
And these slides, I chose these two because I think there's something here about finding your identity. So on the left-hand side, this is from a workshop that we ran a while back for families. And this idea that art materials almost, that this child here is almost seeing them as something to consume. They could be eaten. And to me, offering art materials is like serving a meal. It's like feeding somebody. And I think that comes from my therapy background. It's like being given something wonderful. And how easy, I think, in my recollection, that you can take it and consume it or accept it tells you an awful lot about the relationship you're in with the therapist.
Yeah, what I love about art therapy and the art materials is that although the blank canvas or the blank piece of paper can be quite scary, actually, instead of sitting someone down and saying, tell me all about your life, the art materials can kind of hold a lot of that fear. It's less threatening. If you're sitting with somebody and you're both drawing and there isn't that same intense eye contact, that can really put people at ease. So that's what I enjoy about the art materials in the session. The flip side of that is it can create some anxiety, but it's about you as a therapist to try and manage that for people, I suppose.
And I think also within art making, for me, I'm very interested in processing and this sense of trying on different identities.
Yeah.
And I think you can experiment with who you are, experiment with your voice, with different materials and things like that. And it's a safe way because the therapist is there to hold that space.
And although you can keep the art safe for them, what they make belongs to them. And if they want to rip that up at the end of the day, then that's their choice. I would always it's not comfortable when someone does that, but I suppose, like you're saying, it gives them that safety. They can try different things out within that context. And there isn't that pressure to have, sometimes I think people think when you're in a session that you're going to come out with like this amazing product at the end, and it's like, well, that's not quite so important, really.
And I think that for me, the creative process it has to be playful. It has to, I know it, and it always obviously it goes into a more serious area and the complexities and the subtleties of that. But I think the actual approach, sometimes you can come at it in different ways, but it's about, there is an acting out, isn't there, with materials in a sense. There's a kind of
definitely, and you can bring play into that as well. With kids, you can play act different things, dress up as your children are doing there. But even with adults, it's about having that sense of humour and like making silly things and having a giggle and it not having to be serious. Sometimes it is serious, but yeah.
So I've put this slide in, this is just a piece of my work, but what I liked about this one, it just kind of came to mind that this idea of professional creative identities, sort of things that are the same. So these are ink blots, sort of like, and I like the idea, because I did play around when I was working as an art therapist with this idea of, looking at what you can see, and what that tells you about the way that you're perceiving it. And that's kind of the same, but different. And so these have been 2 ink blots that have been pressed together. And I kind of, to me, I felt it's rather similar to the setting of in art therapy in a sense that you work with transference of there's a kind of mirroring and a kind of what gets put on one person and that space between becomes very important as well. And that to me in my arts practice is also there. There's that sense of the space between me and what I'm making and there's a conversation that goes on.
Yeah. I don't know, I had a thought there. Should we explain what the Rorschach ink blot?
Oh yeah.
Do people know what that is? Or oh, okay. So back in the day, maybe about I don't know, over 50 years ago, psychologists used to use an ink blot that a patient had made, or I don't know if the patient had made it, but they would then get the patient to interpret, find images within the ink. And apparently this held a lot of psychological weight, in that you could tell a lot from a person by what they interpreted. And I think modern day, we wouldn't be quite so inclined to jump to such conclusions, would we? But
how clever they were.
Yeah. So sorry, I've kind of taken a bit of a different.
No, I think that's a very valid point, and it is. It's. I think there's something really interesting I've always struggled with the therapist side of it, is what's expected of you in terms of looking at artwork. Mm-hmm. Look at somebody's artwork, and you've shared that experience with them of making the work, but then there's this expectation that you might be able to divine something that's going to be sort of make things better in some way for them, or give them some big insight, and that's a sort of expectation that's on you.
I do find that a lot with working with adults in particular. Kids are less concerned with it, but there is that fear, that you're going to interpret their artwork and, delve into their deepest, darkest secrets. And yeah, so it's about kind of reassuring people that it's more about me and you exploring this together as part of a process, rather than me coming along and saying, oh, you've used black, you must be deeply depressed, that it's kind of, because people can tell you all sorts of stuff and draw you all sorts of stuff to lead you on a completely different path. So I think, to me, it's about that relationship and creating together and looking at together, to kind of find those insights together, rather than.
And I love that. I think it's the relationships, isn't it? The relationships that's come through. And I think whether you're an art therapist or an arts practitioner, it's about being attuned mm-hmm. to the other. And yeah.
Absolutely.
I wonder, Sinead, if you'd like to say a little bit about transference and countertransference, because I often think that's a fascinating area, because I think that's always at play.
Yeah, I remember in the training, like trying to get my head around these kind of issues, like the word trans. Mm-hmm. What does that mean? And really, the bottom line is, it's just how another person makes you feel. Mm-hmm. And then the countertransference is how you are responding to how they make you feel. And so artwork can bring in a really interesting element to that, because you can have conversations on the page with someone. You can, bring in bits of how they came into the room. I don't know if I'm making any sense, but
no, you are. Making perfect sense. And I think that's what I find fascinating, because I think, having done the art therapy training, that's always there then in your mind when you're approaching making things in terms of artwork, how things make you feel. And maybe that's my attraction to process, is I get very interested in how I feel. And it's almost like trying on a different identity. If I work with glass, I'm suddenly working in a glass making facility, or printmaking. Oh, am I a printmaker? And how does that make me feel? And then there's the whole imagery and the thought processes that brings up too.
And that can be quite interesting, because sometimes, when you first meet somebody, you get an impression of them, don't you? And you just get that kind of gut feeling. Sometimes you can't really put your finger on it, but sometimes what you're being presented through artwork or how they are is quite different. And I always think it's interesting to hold on to that first impression, because that can tell you so much. And that, again, that first image as well. It's like, you'll always go back to that first image, because that's the one that's kind of got it all in there.
And I think that's a very pertinent point too, that in art therapy, you keep all the imagery, don't you? You keep all the imagery that's made, and you have to keep that for how long? Quite a long time.
Now, I think that might have changed, but at one point it was something like 10 years. I'm not sure, I would have to check, but so you keep the artwork for the person, and they can choose to either take it away, or you can, I don't know, keep hold of it at the end themselves. And it's confidential as well.
So they're treated like medical notes, really, the artwork that's produced in that session.
Sorry, what was that? You broke up a little bit there.
So they're treated, the artwork is treated like medical notes. It's given the same value within the institution.
Yeah, it is. So yeah, I think that's interesting in terms of their own identity and what they want to do with the artwork. I mean, I've had some people who've wanted to put on exhibitions. I've had some people who've wanted to chuck it in the bin. You know, so to me, it's like it's a little bit of them. And sometimes, especially in a therapeutic context, it's not always what you want to look at. And certainly it's not always what you want to hang on your wall as a permanent reminder of a difficult time in your life. So,
and I think that again, my memory of working as a therapist is that work can be very messy. And part of your job is to hold that mess and to allow it to happen and to keep it safe within the room. And the actual tidying up of that at the end becomes as significant as the session in itself, is that you can hold that, you can keep it safe, and you can clean it up and make it better, well, repair the room again. And that attack hasn't damaged everything. And I think that idea that art is a microcosm of real life, that person can step outside that room and know that mess can be handled, that challenges can be handled.
Yep. I always find it really fascinating when, you know, you're left, someone has, you know, left a huge mess, and whether they help you tidy it up or whether they just leave you with it sometimes is quite interesting, especially in quite a clinical environment, and especially now, you know, with infection control being really tight as it is. I mean, even wondering about things like, you know, when I give someone a piece of clay, that clay now has to go in the bin. It can't be recycled. When people use pens, you have to kind of sanitize them and things. So, sorry, it kind of went off on a different track.
I hadn't even thought about that. You're absolutely right. And that must impact on the session if the person knows that everything that they've touched has to be then sterile, you know, the way that has to be treated it differently.
Yeah, it was certainly very weird in lockdown because I have a lovely art room that's off the wards, but I wasn't allowed to use that in lockdown. I had to stay on the ward in a kind of converted bedroom, which just brought a whole other, you know, flavour to the session. And we were all locked in, you know, nobody could go anywhere. So it's been interesting times, but we could come on to that later, can't we? Because we're going to talk about.
There's a few questions that I might just come in with now, maybe.
Lovely.
Lynn wants to ask a question. She's an ex-primary school teacher currently studying an art degree, and she's keen to explore a career in art therapist, and she just wondered if you've got any advice for her.
Don't know. I don't know. I suppose what.
There is quite a lot of information on the British Association of Art Therapists, that's BAT. I think they have a page that you can go onto if you Google British Association of Art Therapists. There is a members page, you know, once you become a member of the British Association, you can get further into their archives and their material that they upload on there. But there is a sort of more public facing page, and there are what called SIGs, which are special interest groups, study groups, and each one of those special interest group has an online sort of forum, and you can post things up, and there's one on arts and education. So there's a lot of therapists that do work within education. I do think at the moment, well, actually, I think possibly the schools will be coming more towards that because of all the problems that are now being thrown up with people being online and how they're engaging with schools. I do know my son's schools are looking at setting up a wellbeing unit, and so it has its own, you know, problems. They've been talking about how you do online therapy with pupils and students. So yeah, I don't know if that answers the question. I think it might be nice to explore. I mean, there are books as well written about art therapy and education, and lots of articles have been written.
Yeah, you might find that when you do your training, and I think, so there's, if you wanted to train in Scotland, it would be Queen Margaret's in Musselburgh is the only place that offer it, I think, in Scotland. But I was always dead set on, I was going to work with older people, because that's who the client group I worked with before, and they try, I don't know if they still do this, but for your placements they try and get you out to work with different client groups that you've never worked before. So I'd never worked with children, and I was terrified, and I ended up working with children for 9 years and loving it, you know. So it can be quite nice, you know, to step out of what you know sometimes.
I think some of the problems working in education is that the last group I was on, actually, I went on a couple of the groups over lockdown, was that schools are very prescriptive about classes, you know, it's all timetabled and things like that. And so finding time to work with a young person, you don't want to take them out of class because they become stigmatized, or where are you going, what you, and so it's actually, so art therapy, a lot of art therapy practice is about consistency and continuity at the same time, same place, same room, same materials. And it's quite hard to get that in a school that's pressed for space and time. That's not to say that we shouldn't be trying to have these conversations and make that happen, and it does happen in schools. But I know that some of the therapists who were talking on the webinar I was on were saying that they find it quite difficult, and that actually doing it online was much easier than trying to provide it within the school.
It's interesting.
Yeah. And there is another question that maybe you maybe might answer in this next bit, but I'll just ask it now anyway, just in case. So we've got another question from Denise, who has worked as a self-help guide in the psychological department in Dumfries. And as an artist, one of her questions would be, how do you express yourself? And this was often something the client hadn't considered, but it was often the most liberating way of moving forward, whether it's through painting, singing or cooking.
Yeah. Yeah. Gosh, yeah, absolutely. How do you express yourself? Because we're taught quite early on not to show, you know, to kind of, there's a certain way that people want you to behave and present yourself, otherwise it's seen as being different.
Does that mean, how do you express yourself in a session or as an artist?
I think, yeah, I presume in a session, that's what I'm getting from the question. I could be wrong.
That is interesting. And I think we are going to talk to that a bit, aren't we?
Yes.
Oh no, she says not in general. Not generally, how do you express it? Yeah.
In general.
I think it comes with what we were talking about earlier on. You try on identities in a safe place, you know, whether that's as a child playing, dressing up, and, you know, I'm a policeman, or I'm a fireman, or a nurse, or whatever. You know, you try on these different identities. And as you get older, it's harder to try on identities because you're much more self-conscious. It seems quite scary and risky. And that's where I think the arts really help people, because they can, you know, if you pick up a musical instrument, you know, you maybe can't play the instrument, but you can make a noise with it, and a noise that might express something. Writing, art making, visual arts. I don't know, Sinead, what I think.
Yeah, I'm just thinking of a little bit of training that I did for nursing staff last week, and it was, you know, I brought along lots of different examples, because even within art there's lots of different ways you can obviously do clay sculpting, drawing, painting, the traditional ways, but also I've seen people explore their identity through decorating mirrors and taking photographs of themselves, or, you know, going out into the community, taking photographs, what's interesting to you, almost in a kind of linking with mindfulness, you know, what are you observing when you're going out, and what's kind of catching your interest. In terms of an art therapist expressing themselves in the session, I would be wary of that, because then it sort of becomes about you when you're there to facilitate someone else's self-expression and kind of make that safe for them.
But I think sometimes you can be in a session where somebody's finding it very hard to engage, to let go enough to self-express. And so maybe in an instance like that, there would be a rationale for the therapist to work alongside.
Yes.
Maybe even sort of take the materials out and maybe make a mess, you know, push charcoal around, quite sensory things to just encourage that person who's maybe feeling a little bit anxious about touching things that might, maybe they're worried about getting the dirty hands, or maybe you know, they don't like the texture. And so it's just about kind of encouraging them into the materials, and that it's non-judgmental. It's not, you know, the work's not being looked at in that capacity. It's more about engaging in the process. Would that
makes sense to me? Yep.
Yeah, I think she seems happy with that. It's just that new idea to some adults, I suppose, and rediscovering the thrills of your childhood expression.
Yeah. If as long as you've got a space where you can put out messy materials are always great. You know, I like to put out a lot of different materials. You can see in this slide here, you know, some of the mess that can be, and sometimes it can almost seem like bodily fluids, or you know, if you've got red paint, it's amazing how quick people revert to really messy stuff. But you have to, as the therapist and also the person engaging in the artwork, feel that it's safe and that the mess can be contained. You know, that's really important. Otherwise, it does get very scary. Oh, I've gone away. Sorry.
Sue. Oh, sorry. Just one more. Sue's just mentioned earlier. You mentioned about the fear of a blank canvas, and that most artists have the same fear. And if the participant knows that their work is going to be seen as a medical record, is going to be interpreted in terms of their own personal identity, does that make the fear of a blank canvas even worse?
Yeah, I think, I don't know specifically. So when I would introduce somebody to the sessions, I guess I wouldn't say, you know, anything you make in art therapy is, you know, a record of what you do, and we'll keep it, you know, because it's up to them, you know, they can do what they like with it. Then, yeah, you know, they can take it away. What am I trying to say? No other health professionals have ever asked me for patients' artwork, and even if they did, I would say, no, I'm not comfortable with that. No, in fact, one person did ask once, and yeah, and I did say I'm not actually comfortable with that, because that's that patient's expression, and I don't want that used once you take it out of that therapeutic context and into something else. And also, it's just ethically, it just felt a bit wrong. So,
so I have to say, slightly I think I have done that. I worked in young people's unit, and actually I did ask the young person first. I said, can I? She was very keen that I took her artwork into the case meeting, and it was years later. I was back in the same young people's unit, and one of the doctors there said how useful. He still remembered how useful it was. He said her artwork told us far more about where she was at than any of the observations from the nurses and any of the engagement with the doctors within the unit. So, you know, I think there is a place for that. I think usually people, by the time they come into art therapy, they've been referred into art therapy. But where Sinead and I have worked, we worked in acute admissions, and so people have been referred in for a reason. So you get a reason why they've been referred. They have to, well, they used to have to sort of go and complete a sort of a psychological assessment to see if it was going to be the right therapy for them, and it was a therapy of choice. So I think that there wasn't that nervousness of working with the blank canvas. I don't know. I mean, it was there, but it wasn't something that they were scared of.
I'm just thinking as well, Gillian, in child protection, sometimes artwork can end up sort of in the courtroom, and I don't know how well it stands up as evidence of abuse, for example, but I've never been in that situation, but one of my colleagues has, and it's a horrible experience. And I don't know that, I could be totally wrong on this, but I don't know that it's actually viewed as evidence. I think it's, or I don't know.
Well, this slide that I've put up here kind of maybe leads into this quite nicely. So when I was working as an art therapist, and Sinead and I have had lots of conversations about how difficult it is to come back to your own artwork when you're working once you've taken on this identity of art therapist. And so I was working for many years at a psychiatric hospital, and then I had time off. I had quite a few bereavements in our family, and I had some compassionate leave, time off, and I thought, oh, now's the time. I'm going to make some art. I really want to give myself something. It was a bit like nurturing me. And so I got really beautiful paper and some lovely pencils, really nice and sharpened, and the actual whole process of gathering that to give to myself was important. And then I remember sitting looking at this blank paper and thinking, it's so perfect, it's so beautiful. How can I possibly make a mark on that? How can I, who needs more imagery? The world is full of imagery. What relevance? And I think that said a lot about where I saw myself. What relevance am I? How, what's the audacity I have to think that I can make a mark on this? And in psychological sort of thinking, you talk about attack and reparation. To make a mark on paper is to make a mess, is to attack it. And that can be very much about relationships with others as well. To say you don't agree with somebody is an attack. Do people feel comfortable to voice up how they're feeling? So all that comes into art making and can be played at and looked at within art making. And so what I ended up doing was puncturing the paper, because it was the only way I could make a mark was to puncture. And by puncturing it from both sides, it started to develop this kind of beautiful sort of patina. And my mother, who had passed away, was blind, and so there was a sort of resonance to that sort of sense of equality and of passing through from front to back, and building structures. And so I just thought maybe that might be, again, it gives you a way, people find a solution to jumping in onto the perfect page or the perfectly unused materials.
Yeah, I love this piece, Gillian. It's just, like you're saying, that it's lots of tiny little attacks on the paper, but they've come together to create this beautiful image. It's almost kind of galaxy-like to me. But I hadn't realised that your mother was blind, and there's almost that braille kind of sense to it as well, that tactile.
And also, I think at the time, I remember I'd been to see the consultant, and he said, oh, your mother, she had a heart attack, and he said her heart had just worn out. And I remember thinking, because my mother had brought us up, she had been a journalist, and then when in her day, when you got married, you had to give up your job, unbelievably. And so she then was a housewife. And I remember thinking, how can you wear your heart out loving a family, bringing up your family? And so there was something about wearing out the paper as well. I was wanting to wear through,
the symbolism of that, wearing your heart out,
really stuck with me.
What can wear your heart out, No, it's lovely.
So, then I've got here in this slide, I was thinking about here, how important this creative process is. And so these are just some lovely images that I just love watching people. And I think that comes from art therapy training, because you sit with people while they're making art. I love watching getting involved, and that descent or ascent into that, almost being unaware of what's around you. And I love that when that happens in the studio, you're just so focused, and it's almost telling you what to do next, the process.
So I remember, Gillian, when you asked me about doing this webinar, and I thought, what right do I have to talk about art and art therapy? I haven't done my own practice for really since I trained, and there was this sense of feeling quite fraudulent that I'll be found out for not being an artist and not a proper art therapist. And I think it's through this process that I've realised that to be an art therapist and not make your own art is okay. But for years I've been beating myself with that stick of, oh God, am I doing this right?
That's being an artist and not making your own work. And, are you really an artist? And I find I have periods where I don't make any work, and I'm all in my head. And, you know, am I an artist? You know,
Yeah.
or if you go from an arts degree into teaching, am I an art? You know, how do you know? How do you relinquish these?
Yeah, how do you know when you're an artist? Do you know? Yeah, and I went through the same thing in art therapy as well. When will I be doing this right? When, you know, when will I be the art therapist? It's a strange thing. But yeah, does that link to what you're saying about?
Yeah, I think so. Absolutely, I think it is. It's about you're not being any less creative, facilitating other people's creativity, because you are in. I mean, I don't know about you, but I have the feeling that when you watch other people make art, everybody, you're there. You're at that table. You are in that
Yeah.
process.
Yeah, and that is in some ways the thought, you know, people often say to me, oh, you've got a wee girl and that must be brilliant to be doing artwork, you're an art therapist, and they just imagine you doing art all the time, even when you're not at work. And it's like, the reality of that is like, I don't have the energy to, you know, when I've been looking at other people's art all day, to even contemplate my own process is like, you know.
Right.
And childcare as well, I think we spoke about, brings another dimension into that. I think you mentioned that the pram in the hallway is kind
the death of creativity.
That could relate to that.
An artist's identity. You're being creative with your child, but your own personal. Yes.
But sometimes you've just got nothing left to give at the end of the day. It's like you're so depleted.
Absolutely.
And it's not like a resentful thing. You want to do it, you want to give. But it just means that there isn't much mental space for much else. So I think,
absolutely.
That can be one of the challenges, I think, of being an art therapist.
Yeah. So now I've put these ones up. I'm just going to do, there, I'll put that there. These images here, these are actually drawings by my daughter. Yeah, after a little bit of a plug there. She's an SSA artist, Colette Rayner. And this work is from a solo exhibition that she had in Rotterdam, and exploring concepts around dredging and bringing things to the surface as floaters. And I just love her drawings. I love the way she presents them, and the imagery, and the fact that things come through from the back when she works onto such thin paper. And to me, there's a resonance when I'm thinking about art therapy, this idea of things coming to the surface and how you present them. And obviously on the left-hand side, she's got her work hung, so they are floating. But that sense that of value, when work is presented in a gallery space, it reads very differently to when you see it on the page. And I thought maybe there might be something in there we could talk about in some way.
Definitely. I think it does take it into a different realm. And again, we're viewing it on a computer screen, so it's, you know, it's removed again from seeing it in the flesh, kind of thing. And what does that mean? Does it make it any lesser art? Does it, you know, and you know, does everybody want their artwork to be viewed?
Yes, exactly. So work that's made, I mean, how do you know when to show work and when not to show work? Most people think of artwork as things that are to be offered to somebody, whether it's the child bringing the work back from school, or whether it's something you've made that you want to show other people what I've accomplished, or, you know, or in the therapy, this is what I'm feeling like, this is what I need to tell you.
Yeah, it's interesting, isn't it? I do remember after I did my degree show, and we went down to London and exhibited, all of us together, and like, I had put my heart and soul, as everybody does, into the degree show. There was a bit of me in there. I was kind of laying myself bare. There it was, up for everyone to see. And then somebody walked along and went, "Oh, I don't like that," but didn't know that I was the artist sitting there. You know, and I was absolutely crushed.
It annihilates.
That's a part of my soul up there. You know? So there's that personal experience of, you know, putting yourself out there literally in a show. But I've also worked with quite a lot of people. Well, I worked with one chap who he lives with bipolar disorder, and when he's high, he's really prolific and he creates all the time. And he was really high and he wanted to put on this exhibition. And anyway, long story, it kind of never worked out, but we did have a long chat about why, you know, what happens when he comes down from his high, and how he might feel about it. And inevitably he did then come back down from his high and sadly into a deep depression. And the thought of having a bit of his soul up there for everybody to see, he said it probably would have destroyed him. So he was really glad that we hadn't kind of gone ahead during these manic days and put it all out there. So yeah, there's something so personal but so public as well. It's a very odd.
And that goes across the disciplines, doesn't it? From art therapy, artist, creative practitioner, that sense of being exposed.
Yeah. And yeah, for all to see and for people to pass judgment, I guess. And does it matter if people like it or not? Do you know?
No,
I could have had a completely different reaction to it. Who cares what you think? You know, it was my process, and I own that. That wasn't the reaction I had, but could have been.
Yeah. So with this one, I was thinking again. This comes from I do walks during COVID lockdown, I did walk every day, and I just started to gather pieces and things. And I was particularly drawn to sort of broken things that were broken. And I thought, you know, it might be interesting because obviously it will have had an impact. COVID will have had an impact on your practice. And I picked COVID out. I mean, there are other things that have happened that I think we need to all be concerned about, like Black Lives Matters, the Me Too, all these things. But there's a sense that the whole system is broken, and we're seeing it clearly now for the first time, in a sense. And so for me, finding broken things, I wanted to sort of reorder them. I wanted to take care of them, and I didn't want to repair them, but I wanted to find a new purpose for them, or a new truth about them. I wanted them to take on their own thing in their brokenness. And so I kind of just been gathering them in boxes, and I've got white gloves in there, that idea of care, and putting them into archive boxes. So I'm gathering these all in collections of archives of time spent, which I'm not sure what I'll do with. I have a sort of vision that I might stack them all somewhere as an exhibit sometime. And so I just wondered if maybe there's a conversation here about how COVID and the lockdown and where we are in the world now has affected how you're approaching your practice now. And you mentioned some of the changes in how you engage with patients.
Yeah, well, I was thinking about that, you know, because you posed the question the other day, and, you know, I was thinking, oh, it hasn't really changed my practice at all. But then I thought, no, wait a minute, it really has. Because, you know, before COVID, even just what I wore, like, I'm a health professional, but in mental health, we've never had to wear uniforms till about maybe 5 years ago. And then the NHS brought in, everybody had to wear uniforms, and I resisted it for as long as I could. And then COVID came along, and with all the anxiety about infection control, I didn't really have a leg to stand on. I had to go into a uniform. And I suppose that then takes me even more out of artist role and into, you know, the minute I put that uniform on, I'm Sinead the health professional, not Sinead. I'm still Sinead the art therapist, but you know, it's moving away from that artist identity. And yeah, I don't know that it's not been a terrible thing, but yeah, it has changed it for sure. I don't know if you had any thoughts.
Do you feel, I wonder whether when you're going in, that there may be a slight fear of your patients in a way that wouldn't have existed there before, that, you know, they could have COVID, they could transfer that to you, because normally that wouldn't be in the room with you.
Yeah, I think it's, oh sorry, I've got the window cleaners here.
I love it.
In real time. Well, because, I mean, personally, I don't mind sharing that I actually had COVID back in April, so it was more a fear of me passing on to them than it was, and thankfully, you know, it was all good where I worked, and we were okay. But yeah, it does definitely bring another dimension into the, even just the time, like the extra cleaning that's involved between every patient, and yeah.
And do you wear a mask then in the session? Would that, because I would imagine having your face covered would maybe.
Yeah, so when I'm on the ward, anybody that's on the ward has to wear a mask at all times. Patients don't have to, but we do. So that was during lockdown and we weren't allowed out of the ward. But then as the restrictions started to ease, I got back into the art room, and we can socially distance in the art room as well. It's a lovely big room. So there isn't that need, because I find it really difficult because a mask, obviously, you can't see people's facial expressions, and that's such an important part in mental health and learning disability in particular. If you can't see what, you know, your therapist's face, then even more, you know, what are they thinking, how are they feeling? But so, yeah, it is what it is.
Yes. So I'm moving on, just conscious of our time. So this last slide is a piece of work. I found it very difficult to work over COVID. I kind of found it, my house was, I felt COVID lockdown was very anti the primary caregiver, because in our house I had to relinquish the room that was my studio. I had husband working from home in that. I had the children working from all the other rooms that had access to Wi-Fi for school. And so I was just there, kind of pushed to the periphery to kind of do the trying to source food, care for everybody, kind of make things all safe around them. And I found that quite disconcerting. So my role became one where I would walk, and I was kind of thinking a lot. There was a lot of thinking space, and I think we've spoken about this a little bit, Sinead, too, this sense that what is the potency of art? What is the purpose of art? How do I find something from, what can I give here? You know, going into my studio seems quite, well, I didn't have a studio for a start, but if I was to make work, it seemed almost not important, and I really struggled with that, and that's why I then did contact you about maybe coming back to my art therapy practice in some way. You know, is there something better I could do that would be of more use? And I think in all of this, I started to think about the role that the artist and the art therapist. Part of the thing I've been looking at in my work was to do with deep time, current time, and future time. And I thought, actually, that's what a therapist also is doing with people that they work with. You're looking at people's pasts, their presents, and their future, and you're helping. And so there's something about delving into narratives and the life and the power of these narratives. And the kind of conclusion I came to was that my role was to sort of bear witness to these things. That I was an observer and maybe a researcher of this time, and I had to bear witness to it in some way. And this piece was, we took down an old shed that had been standing, kids had grown up, lots of paraphernalia in it. We didn't even see the shed anymore, it was just kind of collapsing. And with COVID, with time, let's get rid of that shed, let's build a studio. And in clearing out the shed, I found this walking stick, and it was up in the rafters of the shed, and welded to it, this bird had built this nest, and it was absolutely stuck to the stick. This was an old walking stick I had bought as a teenager when I had been on a school trip to Germany. and there was these little broken eggs in it. And I just thought that was a life cycle. There's a bit of my life narrative, there's the bird's narrative,
there's the walking stick that kind of symbolises old age, and then there's, you know, the empty nest with the shells and the, you know, it's...
And it seemed so powerful to me. I thought, actually, you know, that to many people, maybe that isn't an artwork because it hasn't been, I haven't made it, but I've found it, and I feel now I have to look after it, and I value it.
I think, I mean, I would agree, like, so in my art therapy practice, for years I grappled with If I wasn't busy, if I wasn't making art all the time with patients, what did that mean? And was that okay? And it took me years to kind of come to a place of that is okay. Again, I keep going back to, I did this training with nurses last week, and it was illuminating, because I think they thought I was going to come in and say, right, do this, 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 and this, and here's these ideas, and these are things you can do with patients. And actually I didn't say that, because what they were saying was, we find it really hard to get people to engage. We book people in, and some days we get declined, 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 declined. And I said, do you know what? Sometimes just, it's okay to not be busy all the time. Sometimes in our busyness and our wanting to make things okay, and we're missing a point here, that actually sitting with someone and really sitting with them in their distress and not trying to change it, and hearing them, that's an intervention in itself. And they were like, really? What, just sitting with someone? It's like, yeah, because that's actually hard. If you've ever sat with someone that's completely despairing, it's not an easy thing to do. But to fix it or make it look pretty or nice, or, you know, that's not what that person needs. And for me, it was like, oh yeah, I don't have to be the busy art therapist making everything nice and okay all the time. That, you know, that's not my role.
Accepting, witnessing and accepting that distress, and saying, I hear what you're saying. And I kind of feel almost at the moment in my practice, I almost want to do that to the world. That's probably grandiose, not the world, but, you know, the landscape around me. I want to say, I can see what's happening, you know, bear witness to that. Maybe that's a good point to stop. I don't know if there's any more questions, Olivia.
Yeah, there's one more question that just came in throughout the chat. So there's a student that's doing 4th year at Napier studying photography, and the plan afterwards is they'd like to study art therapy with the idea of working with children with autism and hopefully foster care children. So they're wondering if you have any tips. They're also a Spanish student, and they're looking at maybe doing an online course at the Spanish University on how to treat and consider children with autism. So they're just wondering if there are any of the courses that you think would be helpful for them to maybe look at, considering if that's a certain role that they're wanting to go down, working with children. But I suppose, like you mentioned earlier, Sinead, she might think that she wants to do that, but actually when she gets into it, she might like it, she might not. And so maybe when you mentioned about the course being quite varied at Queen Margaret's, maybe that is a better option to start with. I don't know, I suppose it's what you guys think.
Yeah, I think everybody comes into it, you know, with a client group in mind and people that they want to work with and help, and that's absolutely fine. But yeah, I would just emphasise that the course is quite broad and quite general, and a lot of it depends on where your placement is. And I suppose it's a bit like everything else, it's a bit of a postcode lottery. You know, there'll be some areas, some health boards who have lots of art therapists, some who have none. The same with, you know, voluntary organisations as well. And that's, I suppose that's the frustrating thing about it, is there's not always the opportunities for people that should be there when they qualify, because it's such an amazing thing to be able to do. But a lot of it, even during your training, going out on placement, you don't know anything about art therapy, and yet you're having to tell your placement what it is and, you know, how it can help. And so I don't know if that's really a tip, but I guess it is a reality that a lot of it is educating people about the value of art, not just art therapy. Is there anything else you wanted to add, Gillian?
I think for both of them, I would suggest approaching Queen Margaret. You know, there'll be tutors there, admissions tutors, who would talk to them about what they would be looking for, and what they might, because I think part of the thing for going for art therapy, they like students who have had some experience of working in a particular area that's brought them to that point of considering working with art therapy. So, you know, it might be worth having a look to see what they would be wanting. They'd want a portfolio, and that could be photographic work. There's a lovely school of thought in terms of phototherapy. It's a really interesting way to work. So yeah, and there will be things again on the British Association of Art Therapists webpage, I think you might pick up on, but working with autism is definitely an area that art therapists do work in. Yeah.
Mm-hmm.
I think, yeah, that's it, unless anyone else has got any questions they'd like to add in the chat box before we leave. But I think that was absolutely fascinating and such an interesting conversation. Obviously, talking to you both earlier in the week about it just opens your eyes up to a different world, I suppose. And I think it's always interesting, like you say, Sinead, people think you're an art therapist, you're definitely an artist, and that just comes as a pair almost. But like you say, with the work is just so exhausting, so sometimes that you just can't focus on anything else. But it's like, I suppose, with some other jobs and any other, and being an artist in general, I guess, when you're trying to hold down another job and try focusing on your art career, it's just a balancing act all the time, I think.
Yeah.
Which shows how much you give to your creative practice. I think people sometimes think, oh, it's all right for artists, they just go into their little studio and they play around with art materials and they have a lovely time. Actually, it is exhausting. You know, making art is exhausting. It can be exhilarating, but it's also exhausting.
Well, and you have to even get to the studio to start off with. That's one of the main missions, I suppose, to get there, to actually become creative. So I think, yeah, there is some steps behind the scenes that some people don't often see, I suppose.
Mm-hmm.
I hope this has been useful, and I have to say I'm very happy. I'm sure Sinead would be too. If anybody, you know, has any other questions, we can take them later on and answer them.
Yeah, that's good. And this will be going up on YouTube as well, so anyone that missed the beginning or anything. And so you can also comment on there if there's any questions on the comment section, so then you can maybe pop and Gillian and Sinead to see if there's anything that comes through, or we can send them through to you. So that's fine. But I think thank you very much, both of you, for joining us, and everyone that's joined this morning as well. This is the last SSA Council Forum, and but in October we are launching our SSA Professional Development Month, so that'll be through October and November, so it's just exclusively to our members. So if you're not a member and you want to check out our website, there's a lot of events that we're running, a lot of webinars, discussions and conversation about professional development and being an artist, so everyone is welcome to join, to become a member, to visit these sessions. So it should be a few good months. So yeah, I think that's a good way to end, and I hope everyone enjoys the rest of the day.
Okay.
Thank you again.
Thank you very much.
No problem.